This is Brent of the Brookbush Institute, and in this video we're going over static manual release of the Piriformis. Now if you're watching this video, I'm assuming you're watching it for educational purposes and that you are a manual therapist, and in your state it specifies that manual release techniques are within your scope. Now this probably goes for all athletic trainers, physical therapists, chiropractors, osteopaths, licensed massage therapists. You're all in the clear. However, personal trainers, probably not. Now, before I have a patient or a client on the table to do any release technique, any manual work, I'm going to be pretty sure from my assessments that that technique is necessary, especially when it comes to things like the piriformis or adductors where we're getting into more sensitive areas. Obviously, if somebody came in for shoulder mobility issues or shoulder pain and you start palpating their backside, they're going to wonder what's up. Make sure you have a good working hypothesis before you're doing manual techniques. I'm going to have my friend Brian come out. He's going to help me demonstrate this technique. Now, all of these manual release techniques basically come down to locate the muscle, be able to palpate that muscle, and compress that muscle. You get bonus points if you know where the trigger points are, because those are your common points of tightness, and having a general idea of where to place your hands will speed things up a little bit. Now, I've done the due diligence of marking out some landmarks here that we need. I put this piece of tape over the posterior iliac spine, and then you can see it curves down here. Well, I hope you guys can see a little bit that it curves down here over the sacrum. If you can't, you'll get to see that in the close-up. And then here we have the greater trochanter. Now the piriformis runs from anterior sacrum to greater trochanter. The last thing we need to consider, anatomically that is the fact that the piriformis is actually deeper than the glute max. So we have to find a way of differentiating between glute max and piriformis fibers. My glute max fibers generally run this way, kind of vertical, whereas my piriformis is horizontal. So you guys should be able to notice that if you go this way, you can strum some glute max fibers, and they're pretty thick, they're pretty broad. Right, that's a big, thick muscle. Now, the piriformis fibers, if I go a little deeper and I go superior to inferior this way, then I start strumming. I have to get pretty deep though. You guys can tell if you go shallow and go superior to inferior, you don't feel fascicles, you don't feel strings of muscle fibers. Now, as far as finding the tense point, I'm going to go just below my iliac crest here. I'm going to go ahead and start around the sacrum. I happen to know that the piriformis trigger points are either generally very close to the sacrum or right in the middle of the belly of the muscle. So if I take this nice broad thumb this way and kind of go from superior to inferior, I'm going to start by looking for really tight fascicles, because we're going to assume that even if it's a tight trigger point, nodules, that they're still going to pull the fascicles they're attached to pretty tight. Once I found those tight fascicles, I'm going to go ahead and move maybe towards this greater trochanter if I feel like that's where more of the tension is coming from. And once I find that nodule, I would then compress. Or if I feel like it's more towards the sacrum, I could move back all the way to his sacrum and see if pressing superior to inferior, little medial to lateral there to find the most dense tissue until I find that trigger point, and then I could compress there. Now I'm showing you guys all of this on this side so that you can see what I'm doing, but the truth of the matter is from a technique standpoint, from a body position standpoint, I'm going to want to be on this side, right? I'm going to want to do the piriformis that is closer to me, and I'm even going to show you guys a little bit of a trick here. If you have somebody in neutral position, their piriformis is actually not very tight, right? It's actually kind of in a neutral length, and if you just start pressing down, you might start playing that game of like trying to put your finger on top of a marble, or you may just press straight into mush. There's not a whole lot of feedback. So what I like to do, assuming that somebody has no knee issues, is go ahead and take them into knee flexion and then tuck their foot into my arm here, right, my elbow and my armpit. And that way, as I'm palpating his piriformis here, I can pull Brian into internal rotation, which is going to lengthen his piriformis, increase the tension a little bit, right? So that now those fibers are pulled just a little taut. I'm not trying to stretch his piriformis this way, but I want those fibers pulled a little taut so that when I go to press on that trigger point, it doesn't do this to me. All right, so I'll pull down, once again, broad strokes. I'm going to go superior to inferior to find those fascicles. And then I'm going to go either proximally towards his sacrum or distally towards his greater trochanter until I find the most tender point. I'm going to use this hand as my dummy thumb in this case. All right, I'm going to go ahead and put the other hand to apply pressure. I'm going to try to straighten out my arms, get as much tension as I need here, and then I'm just going to lean in with my body weight until I feel that point where the tissue density really starts ramping up. I don't want to go all the way to the tissue end point. I don't want to go all the way to an end feel. I don't want so much pain that I actually get the muscle contracting under my fingers. I'll never get a release. But if I go right up to the point where I feel that increase in tissue density, and I lean until I feel a release underneath my fingers that is a decrease in tissue density, or Brian tells me, you still feeling that? Mm-hmm. All right, he's still feeling that. I'm going to hold it for a few more seconds. If he says that he no longer feels the soreness, he no longer feels the uncomfortableness, the discomfort, then we can go ahead and move on. Starting to let go, right?
Yeah, it's a lot looser now.
Yeah, your piriformis was pretty jacked up.
Of course.
All right, so next up we'll do our close-up recap, guys, but I hope from this position you guys kind of see my body position. Manual therapists, you always have to be thinking about you first, and I know that sounds crazy, but notice once I had him in position, my arms were straight. I pulled him into as much internal rotation as I needed, and all I'm using is body weight. Specifically, this hand is pressing over this hand, which is totally relaxed, so that I'm not wearing out joints. I'm not putting myself in a compromised position. Okay guys, here's our close-up recap. You can see I've marked out the posterior ilium. I've marked out the sacrum here, is where this tape turns down. And then I've marked out the greater trochanter. We know his piriformis goes from anterior sacrum to greater trochanter deep to those vertical glute fibers to add tension to his piriformis so that I'm not playing the try to put my finger down on a marble, or I'm not just pushing into mush because all of these muscles are relaxed in this position. I can add tension by pulling Brian into internal rotation here. So I'm going to tuck his foot up in my arm. I'm going to strum superior to inferior to find those horizontal fibers. Once I find the tightest fascicles, it helps to know that most of your trigger points are going to be located either closer to his sacrum or in the middle of the belly of the muscle. So once I find those tightest fascicles, I'm going to move in one direction or the other until I find a nodule or acute point of increased tissue density. I'm then going to apply pressure by letting this hand relax and placing the other hand over top, straightening out my arms and leaning in. I'm then going to hold that until I feel a release, or I can do the other protocol, which would be 5 seconds on, 2 seconds off. 5 seconds on, 2 seconds off. I think I've mentioned in previous videos that I do tend to gear towards the static hold, and usually 30 seconds to 2 minutes does the trick. Hope you guys enjoyed this video. I hope you add static piriformis manual release to your repertoire and use it when necessary. Let's talk a second about what assessments would lead me to believe that the piriformis needs to be released. If we're talking about the overhead squat assessment, we're talking about knees bow out, an inadequate forward lean, a posterior pelvic tilt, or an asymmetrical weight shift. That would be the piriformis opposite the side of the shift. If we're looking at goniometry, we're looking at either a lack of internal rotation in prone, or if we're doing those supine tests, piriformis will actually cause a reduction in range of motion in either direction. That has to do with that weird action of the piriformis, where if you get closer and closer to 90 degrees, it starts to become more and more of an internal rotator rather than an external rotator. If you don't know what I'm talking about, look up the Piriformis article on brookbush.com and you guys will see. You could possibly consider something like the fader test or the hip impingement test, which are both special tests for the hip, as also indications that this may be tight. From a pathology perspective, although I don't like to go from pathology to technique, if somebody had gotten diagnosed with piriformis syndrome or sciatica, I would also definitely put this technique in my repertoire just to see if we could get any abatement from symptoms. Now, mind your scope, mind your technique as far as your body position, and of course, stay specific to your assessments. I look forward to hearing your comments. Please leave your comments below if you have any questions. If you think I left anything out, please let me know. I'll talk with you guys soon.